The 3 million Ghana cedis decision. You've got 3 million, 5 major health problems, 1 decision, and every choice has consequences. What is priority setting? You sit down and realize this is not just choosing randomly. Priority setting is a structured and systematic process of ranking health needs and allocating limited resources among competing demands. It involves identifying and selecting health problems based on evidence, allocating budget across competing programs, determining the focus of interventions, and planning phased implementation because not everything can be done at once. So, it's not just a choice, it is a strategic process of deciding what comes first, what comes later, and what may have to wait. Why priority setting matters. You look at your budget again and reality becomes clearer. Let's break it down deeper. Resources are limited. Money, health workers, hospital beds, equipment and time are all scarce. Health needs are unlimited. New diseases emerge, old ones persist, and population needs keep growing. Maximization of health outcomes. You want to achieve the greatest health impact with the resources available. For example, vaccinating thousands may save more lives than treating a few advanced cases. Efficiency. Avoid wasting resources on interventions that give little benefit. Equity. You must consider who is suffering the most. Rural population, poor communities, vulnerable groups. Ethical responsibility. Every decision means someone benefits and someone waits. That's the moral decision, not just a technical one. Accountability and transparency. You must be able to explain why did we choose this and not that. Support universal health coverage. Ensures that essential services reach everyone without financial hardship. So those are why priority setting matters. Let's move to what influences your decision. Now, pressure starts coming from everywhere. So let's unpack it properly. Epidemiological factors. What diseases is killing more people? Which is spreading faster? Use mortality rate, morbidity rate, disability adjusted life years. Example, a cholera outbreak spreading quickly may demand urgent attention. Resource constraints. Do you have enough doctors, enough medicines, enough facilities? You might want to solve mental health issues, but lack of specialists limit action. Economic considerations. Cost effectiveness. Which intervention gives more results per city? Opportunity cost. If you choose A, what are you giving up? Okay, choosing dialysis for a few versus vaccination for many. So those are the economic considerations. Political factors. Government priorities, election promises, and public pressure. Sometimes what is politically visible gets attention, even if it is not the highest need. Social and cultural values, community values, religious views, lifestyle practices. Some communities may resist certain interventions. Donor influence. Donors may fund HIV programs, maternal health, but not others. So your decision may shift based on available funding conditions. Evidence availability. Do you even have reliable data? Weak data is equal to weak decisions. Good priority setting is evidence informed. Ethical considerations. Fairness, equity, protecting vulnerable groups. Sometimes you prioritize not because it's biggest, but because it's most unfair. How do you decide? That is the criteria. Now you move from confusion to structure. You begin applying criteria like a professional. 1. Burden of disease. How many people are affected and how severe is it? Cost effectiveness. Which intervention gives maximum health benefits at minimum cost? Equity. Who is being left behind? Are rural or poor populations suffering more? Feasibility. Do you have skills, infrastructure, political support? A good idea that cannot be implemented is useless. Urgency. Will delaying action cause death? Outbreak? Cholera is equal to high urgency because delaying action can cause death and outbreak. Acceptability. Will people accept the intervention? Will stakeholders support it? Alignment with policy goals. Does it fit national health strategies? The SDGs? Now, let's look at decision insight. High burden plus cost effective plus feasibility would be top priority. Low burden but affects vulnerable groups, still priority because it has an equity reason. Now, something deeper hits you. Your definition of health shapes your decision. We have biomedical model. It focuses on diagnosis and treatment. Priorities are hospitals, drugs, surgeries. We have social determinant model. Focuses causes of diseases. Priority will be sanitation, education, housing, and rest. We have holistic model. The focus is on total well-being. The priority will be on mental health, lifestyle, prevention, and treatment. Now let's look at the stakeholders. This is bigger than you. Each stakeholder has a role. Government sets policy, ensures accountability. Experts provide data and technical analysis. Communities define real needs and influence acceptability. Donors provide funding, shapes priorities indirectly. Private sector brings innovation and improves service delivery. Good priority setting is equal to balanced participation. Let's move to the principles. You want your decision to be respected, so you follow 1. Transparency, clear process, open decisions. 2. Inclusiveness, all voices matter. 3. Evidence-based, use data, not assumptions. 4. Relevance, it has to fit the local needs. 5. Revision and appeals, decisions can be reviewed. 6. Enforcement, ensure implementation actually happens. In an emergency room, patients are sorted based on severity, urgency, and survival chance. This is priority setting at a micro level. You finally choose, and you realize priority setting is not just about money. It is about impact, fairness, and responsibility. In life, you will always have limited time, limited energy, limited resources, but your power lies in this. What you choose to prioritize shapes your results. This is Eric Podcast.